everyone, I'm Leslie Orr, speech and language therapist in NHS Lanarkshire and raising awareness of developmental language disorder ambassador. Thanks to everyone who sent questions in for our raising awareness of developmental language disorder or DLD question and answer session.
We were asked, why is developmental language disorder not widely recognised in North Lanarkshire?
The term DLD is relatively new. Before 2017, there was a huge variety of labels used to describe language learning impairments. So things like language delay, language difficulties, specific language impairment, language disorder. Now the speech and language therapy profession has a clearer understanding and international agreement on terminology. This will help to increase consistency in use of labels and informing diagnosis. Language difficulties are widely recognised across NHS Lanarkshire speech and language therapy. We are working hard to increase awareness of the new terminology within the service, within the public, with the public and with partnership agencies. For example, through social media, formal and informal discussions with education and health colleagues, within local SLT team meetings, and this month we actually have a journal club session for speech and language therapists devoted to developmental language disorder. We have a system for sharing new resources and promoting discussion and learning for all. The Raising Awareness of DLD campaign is working hard internationally to highlight DLD, and the Royal College of Speech and Language Therapists help guide the profession in the UK as well. With increased awareness and understanding, over time we aspire for DLD to be widely recognised across health, education and the general public.
We were also asked, where can people seek support for those with developmental language disorder?
Children and young people with developmental language disorders are usually identified as having language needs by their parents, public health nurses, early years practitioners, or within primary or secondary schools. Although they may not have a confirmed diagnosis of DLD, general supports can be put in place by all these people. For example, by adjusting language used when communicating to help the child understand, or by creating communication-friendly environments. Speech and language therapists can support children, young people and families. The approach and type of support will depend on the individual child or young person's needs. In NHS Lanarkshire, we have an inquiry service for the public and professionals to access support and advice at any time. Within education, class teachers, specialist support teachers and educational psychologists can be part of the support network. Inquire.org.uk is the Scottish Advice Service for additional support for learning. They are able to provide advice and support to help families and schools work together. The Raising Awareness of DLD website and NAPLIC website are good sources of information and support. As part of the RADL campaign, there are new resources, podcasts and blogs year on year, which many parents find helpful. Unfortunately, we have been unable to locate any local support groups for DLD. Based in Dundee is the Speech Language Communication Company, which is Scotland's only charity set up to support the needs of children and young people who experience speech, language and communication problems.
Someone else asked, are there any famous people with developmental language disorder?
Unfortunately, we haven't been able to find any information confirming any famous people with DLD. Due to the terminology changing only 3 years ago, it's likely that there are adults out there who fit the criteria for DLD but are not aware of this. Hopefully through time this will change. Sophie Franks, who lives in Surrey, is an adult with DLD and a Raddled ambassador. Sophie is very inspiring to listen to and famous in my eyes.
Someone else asked, is a speech sound disorder part of developmental language disorder?
In a speech sound disorder, a child or young person has unusual or persistent speech sound errors. This is not part of DLD, but can occur alone or with DLD. The core difficulties in DLD are with understanding or using language, like difficulties following instructions or answering questions, and difficulties putting words together and using sentences to tell a story.
And finally, we were asked, do support strategies which help autistic children also support children with developmental language disorder?
Strategies to support children and young people with language and communication needs are common across different conditions. The label does not determine what strategy will be helpful. The strategies are determined by the needs of the child. So for example, a child who has difficulty processing and remembering instructions, it might be helpful to break the language down into smaller chunks, to repeat what you've said, perhaps use a visual to aid the child's understanding, and to speak slowly. If the child has difficulty remembering a word, then helping them to describe the word or to use a gesture or a picture to show you the word may help. Some children with DLD can experience anxiety. This may be related to difficulty understanding what's coming next, for example, and they might benefit from regular routines and visuals to help reduce their anxiety and increase their understanding. Autistic people can have a language disorder as part of their profile. When this is the case, the label language disorder associated with autism is appropriate. Developmental language disorder is used when the language disorder is not associated with another known condition. That brings us to the end of the Q&A session. Thanks for watching.
You can follow NHS Lanarkshire Speech and Language Therapy Children and Young People Service on our social media, on Twitter at SLT North and at SLT South Lan, and on Facebook search for Speech and Language Therapy NHS Lanarkshire. You can contact us via our email address sltinquiry@lanarkshire.scot.nhs.uk or phone our helpline number on 01698 687 606.